Hello and good morning. Today our topic is the anatomy of the kidneys, and we'll try to cover it in as much detail as possible. So, here is the urinary system. Urinary system generates urine for the body, and the main organ generating urine is the kidney, and then it travels through the ureters, which are muscular organ, and then it reaches the bladder from the posterior side. The ureter is open in the bladder from the posterior side, and then there's the urethra, and the urethra has three parts: prostatic urethra and so on. So uh, kidney functions. Its function is filtration. Filtration of what? Filtration of blood. Excretion of what? Excretion of urea. Secretion means that things that kidneys secretes are not going out of the body. They are staying inside, but it is still secreting it in the tube. Okay, in a tube. And regulation of what? Regulation of homeostasis of the things that are in the body, and some regulation of water and etc. The minerals and the metabolites, whatever you say. Location. Reins, meaning kidneys, are located in the posterior part of the abdomen. They are quite close to the posterior abdominal wall, and one on either side. We have two of them, and behind the peritoneum. Behind the peritoneum means they are not exactly the part, or the peritoneum is not exactly covering it. It is a retroperitoneal organ. So their upper extremities on the level of upper border of the 12th vertebra. They are up on the upper border of 12th vertebra, and lower extremities with the third lumbar. Okay, meaning 12th thoracic and third lumbar. They are between the 12th thoracic and third lumbar. Okay, the right kidney is above the left one, slightly above the left one, because of the the liver. Okay, so relation knees to the vertebrae and rib. Here you can see kidneys are lying behind the posterior abdominal wall. So there are different layers of the kidneys. First of all, here you can see the kidney. The first layer is the uh, fat layer, which is covering the kidney. Here you can see. Then there is the fibrous fascia, and then there is the renal gland, and kidney is itself covered by some fascia. Okay, then there is the fat layer, and then there's the fibrous tissue. So here is the renal pelvis in the hilum, and then there's the ureter. And here is a incomplete view for the kidney. As you can see, here is the posterior abdominal wall, then here is the kidney lying. This is the hilum of the kidney, and there's a vena cava, and this is the aorta, and this is the pararenal space, like lying next to the kidney, and this is the posterior pararenal space, and these are the vertebrae, as you can see. Okay, moving on. The relationship of the kidneys with other structures. It has anterior and posterior surface as well, and lower and upper poles, and medial and lateral border, and we will see the relation. This is a cut section, as that is a sagittal section of the kidney. Here is the hilum, here is the adrenal cortex, and this is the adrenal medulla, all of it, and this is the cortex, and this is the outside of the kidney, and here's the hilum again, and then it will form the ureter. Okay, so anterior surface is right kidney. So its relation, or upper part, is forming relation with the suprarenal gland, of course, that's there, and with the liver, with the duodenum. I'll show you right on, and lower part is with the colic fracture of ascending colon in the small intestine. I'll show you. So here's the pelvis of the kidney, the hilum, and this is the ureter, the left kidney. Here's the diaphragm, okay, and inferior vena cava, so on. And this is a quite good picture of the kidney. Right one is following, making an impression with the liver, and as you can see on the liver, there's a real impression there of the kidney, and it is called as renal impression. And here you can see there's the kidney, and duodenum is in front of the kidney, not behind it. And this are the intestine, large intestine. It is also in front of the kidney. So here you can see the complete anatomy of the kidney, and anterior surface. As you can see, here is the kidney, and everything else of the left kidney is in front of it. This is the pancreas, okay, the liver, the stomach, the duodenum, all of them are front of it. See, here's the left kidney, this is the large intestine, okay. Uh, all the muscles of the posterior abdominal wall are behind the kidneys. For example, diaphragm is, and transversus abdominis, and quadratus lumborum, and the psoas muscle. So medial border, here's the medial border, this is the medial border, and this is the hilum of the kidney, and this is the renal artery and vein, and this is the ureter, as you can see, which the urine travels through into the bladder. So internal structures of the kidney are these, and this is the chorus, this is the medulla, this is the medulla, and these are the lobes of the kidney. As you can see, lobes, lobes, okay. And as you can see here, the medulla, the cortex again, and in the spaces between two lobes are called columns, and where there's the medulla opening in the major calyces are called renal papillas, the opening of the renal medulla, and this is the ureter. And first of all, there is a minor calyx. There is a minor calyx, and then there are the major calyxes, and then they all form one, forming renal pelvis. Okay, as you can see, then there comes the ureter. So here is the cortex, C for cortex, M for medulla, and a nephron is lying um, between the two of them. Half of it is in the cortex and the half of it is in the medulla. So let's see. It's the half of it is the cortex, half of it is in the medulla. So this is the glomerulus and the Bowman's capsule, then the proximal convoluted tubule, and then ascending and descending limb, the distal convoluted tubule, and the collecting duct. Okay, and then there's the blood supply. Blood supply, as you can see, it is directly supplied by the aorta, and directly drains into the vena cava. So renal artery, it is making renal artery is coming from the aorta, and renal vein. uh, there are three further divisions of the artery. First of all, there is a segmental branch, segmental arteries, and then when they reach the medulla, they uh, divide into interlobular arteries between the lobes, meaning between the lobes, and then they go to make the arcuate artery, making an arch with the medulla, and then they divide into interlobar artery. This is not a P, this is a B. Okay, interlobar arteries, or it can also be called cortico-radiating. Okay, cortico-radiating. So here is in the structure. First of all, there is a main artery of, okay, and then it will make the glomerulus in the Bowman's capsule. Then you can see, and here is the nephron artery, and then it forms a vasa recta with the vein plexus interlobular vein. Okay, and this vasa recta surrounds the descending and ascending part of the nephron, because there are the secretion is taking place, the uh, excretion is taking place, and so on. Excretion and secretion between the arteries and the lumen of the nephron. So then here is a structure again, a bigger one, as I've explained to you before. Same things happening here. Here are the vasa recta. Thank you very much for listening. Goodbye.